Hi to those who have joined so far. It is just the hour, so we will wait for a few more participants to come onto the platform, and we can get started in just a minute. Okay, welcome everyone. Thank you for joining the International Council of Nurses and Sigma virtual parallel event called Nurses Take the Lead, Creating Gender Responsive Global Health. We'll kick off. It's a very busy schedule. There has been thousands and thousands of other events happening over the past 2 days, all across time zones. And so I suspect that more people will filter in, but we'll want to start this important event. I encourage you to tweet and post on social media using the hashtags that you see there on the screen. Hashtag CSW65 and NGO CSW65. And if you could kindly tag both ICN and Sigma, we're at ICN Nurses, and at Sigma Nursing, which you can see on the slide there. I am so happy to moderate this panel today. My name is Erica Burton. I'm the Senior Policy Advisor at the International Council of Nurses, and I'll be your moderator. ICN is a federation of national nursing associations in over 130 countries and the global voice of nursing. We represent over 27 million nurses worldwide. We are so pleased to partner today with Sigma Theta Tau International Honor Society of Nursing, or known as Sigma. Sigma has more than 135,000 members in over 92 countries around the world, and they work to develop nurse leaders everywhere, anywhere to improve healthcare everywhere. So just quickly, some housekeeping. All participants are automatically muted and their video is turned off. So please do use the chat function at the bottom of the screen to actively participate in the session. There will be an opportunity at the end to post questions to the speakers, and we encourage you to type those questions into the chat box. So we're in the first week of the 65th session of the Commission on the Status of Women. I am so pleased to be here amongst all of the powerful women, non-binary people, as well as our male allies. 90% of the nursing workforce are women. Nurses have played a leading role in the COVID-19 response, and as such, it is women who have been on the front lines of this pandemic. And though they are the majority, women hold only 25% of leadership roles in health. So during today's event, we will hear from several distinguished women about how increased and strengthened involvement and leadership of nurses in the COVID-19 response and recovery is essential to building back better and to preventing similar failures during future global crises. I would like to open the floor and the event with remarks from ICN President Annette Kennedy and Sigma's CEO Liz Madigan, both who have been exemplary leaders during this pandemic. Annette, you have the floor.
Thank you, Erica. And hello, everybody across the world. I'm delighted to be here with my colleague, Elizabeth Madigan from Sigma Tau. And on behalf of ICN, I would love to welcome you to this session on Nurses Take the Lead, Creating a Gender Responsive Health. This is so important. But first of all, on the day that's in it, I would very much like to wish you a very St. Patrick's Day. Happy St. Patrick's Day. It's the most important day in the Irish calendar, as many of you across the world will know. I'd just like to make a few comments. First of all, as Eric has already said, nurses make up 90% female, but we're 60% of the healthcare workforce. We're on the front, center, and the backbone of the health service, and never has it been more apparent than now during the COVID pandemic. For over a year now, we've been on the front line of the fight against COVID-19, working in health systems that have not only been unprepared, but were weak and under-resourced, following years of austerity. We faced the pandemic with a global shortage of 6 million nurses. Nurses faced the brunt of the pandemic with the lack of PPE, lack of education and training, lack of support, inadequate testing, tracing, and occupational health. And of course, the fear of contacting the virus or bringing it home to family and friends. And they have seen many of the family and friends die from COVID-19. But for many women who are nurses, balancing work and family responsibilities has always been a challenge. But the pandemic shed a light on these long-standing gender inequalities. Many nurses had the burden of child rearing and of caring for older families, and many were single parents. The pandemic, along with the associated closure of schools and creches and childcare facilities, increased heavily on the time that nurses had to spend, both in unpaid work and in paid work. And for some governments, it fell to them to actually support nurses in childcare support, funding, and facilities, but only some, because of course nurses can't work from home. ICN have also been informed of many incidents of violence and abuse against female nurses, physical assault, verbal abuse on public transport, being thrown out of rented accommodation, being refused creche facilities for their children because of individuals' fear of contracting the virus from the nurses. This is part of the gender gap, concerns that may fail to factor into policy, violence against women and women's unpaid work. Nurses have also been invisible on national health task forces, committees on COVID strategy, or on media briefings. Yet nurses are the closest to the patients, to the community and the families, and know more about the needs of the patients than any other health professionals. But we always seem to be the implementers, but never the decision makers. When we are designing health systems that are meant to work for everyone, men, women, and children, we need nurses, we need women in the room, in every room, where a decision is made. It's not an option, it's crucial. The gender data gap is not just about involvement in decisions. The data gap impacts on women's lives. Women are genetically different in every cell in their body, from the effects of medication on women, symptoms of disease are different, sexual and reproductive health. Yet data on gender difference is never collected, or very rarely. For me, the solution to gender data gap is to close the female representation gap. When women are involved in decision-making, in research, in knowledge production, in every aspect of life and living, only then will we have a world that works for society equally, for women, for men, and for children, and in turn, better health. The issue is not about fixing women. It's about recognizing our difference equally as individuals, complementary but different. Thank you.
Thank you so much, Annette, and thank you for pointing out that the challenges are really outside of women. And happy St. Patrick's Day to you. And now, Liz, CEO of Sigma, the floor is yours for your opening remarks.
Thank you, Erica, and good morning and good day, good afternoon, good evening, everyone. We so appreciate being able to work with our partners from the International Council of Nurses on this important topic. I echo everything Annette said. I would only add that the predictions about how many nurses are intending to leave the profession are daunting. If these come to pass, as Annette said, we already have a critical shortage of nurses, and the nursing workforce has been so severely impacted by the events related to COVID that it really is a frightening prospect if these predictions come to pass. We need to do everything we can to support nurses in their current positions. We need to make sure that the health systems, we need to advocate so that the health systems provide them with the support that they need. Nursing organizations are stepping up to help provide support for nurses who've been impacted. We know that there is a level of post-traumatic stress disorder, but even for those who aren't necessarily diagnosable, the impact in terms of the work that they've done is going to continue to reverberate for quite some time. The health systems, of course, have been under pressure for many years, and the additional stress of COVID essentially fractured the systems. So if we do not take action to make the systems better now, when we have our next global event, we're going to be in an even worse situation than we were coming into COVID. I've heard people talk about the before times and getting back to the before times, and I think we all recognize that the before times are really gone, that we're never going to get back to those before times. So what we need to do is commit to making the world a better place, especially for healthcare, because that's our primary focus. And the way to do that is to provide nurses the opportunity to make the contributions that we know they can make. As Annette said, because so many of the nurses in the world are women, we've dealt with this gender issue for many, many years. And if we don't address it now, we're going to be in a worse situation. I would only add that we need our male allies to help us with this advocacy role. And we know advocacy is a critical position for nurses to take. Nurses are in the United States for 20 years in a row, have been the most trusted profession. I'm very proud of that. I wish we were equally respected. I admire the fact that we're trusted, but we need to be respected. And if we were respected, we'd be at all the decision-making tables we need to be at. So I would encourage you all to think about nurses as respected as well as trusted. I think the other piece to bring out is the fact that we know worldwide that if you improve the situation of women anywhere in the world, you improve the functioning of the family and you improve the community. So I think in addition to nurses having a leadership role to play in the healthcare system, I think we have opportunities to contribute to community development as well. And finally, I'll close by saying, as the vaccine rolls out, half of the world's workforce is nurses. We're poised to do this. We're great vaccinators. We just need the opportunity to be involved in the situation. So with that, I'm going to hand it back to Erica and let her continue because we have a great panel and I'd really like for you to hear from them. Thanks so much and happy St. Patrick's Day.
Thank you so much, Liz. And I think that nurses are absolutely at the forefront to take those before times and change them and turn them into now times fit for purpose. Thank you to both of you. There is absolutely no doubt that nurses around the world have cherished both of your leadership and guidance during these very difficult times. So moving on to our speakers, our first speaker will bring what I expect to be a very sobering look at the reality for women on the front lines of the COVID-19 pandemic. Italy was one of the first countries hardest hit by the pandemic, and nurses all over the country stepped up to respond, many facing dire working conditions. Cecilia Cerrone is an expert in nursing education with an MSc in nursing research from King's College. She was the president of the Italian National Nursing Association for 2 terms from 2011 to 2018. For the last 34 years, Cecilia has taught nursing sciences, research, and history in several universities across Italy. From 2001 to 2011, she represented Italy in the working group of the European Nurse Researchers and has represented Italy in the European Federation of Nursing Associations. Cecilia, I welcome you to the floor.
Thank you. Thank you. Thank you very much for the introduction. and thank you for giving me this opportunity. I'm proud to represent CNAI, the oldest Italian Nurses Association in ICN, and member of the Italian Federation of Women, linked with the International Council of Women. The reason for this affiliation is that although we have 30% of male nurses in Italy, nursing was born only female. In these 10 minutes, I will try to convey my experience of 40 years of passionate life in nursing. If COVID-19 pandemic has a merit, this is that it has finally highlighted some weaknesses of our healthcare service. If our NHS has answered more timely than other countries in the first wave of pandemic, we cannot say the same for the second, and now we are in the middle of the so-called third wave. I have to tell you first that we are exhausted. Next slide, please. It has been very difficult for me to choose what to say. I will try to go through these points. The first point is about some data on female occupation. Next, please. On the 8th of March, the President of the Italian Republic, in his speech to celebrate Women's Day, quoted some recent data. I just say something. According to this data, the Statistics Institute of Italy, 1,300,000 jobs for women operating in sectors particularly affected by the crisis are at risk. And not only the quantitative data are of concern, the quality of women's work is worsening. And the situation of women is also critical from a health point of view. And there is nothing to be happy about. And now, what about nurses? Next slide, please. A 2020 survey shows once again that Italians do trust nurses, like in US and in all over the world, I think. However, some obstacles prevent the full potential of nurses being used. In Italy, we have this total number of registered nurses, and 76.5% of these are women. We have 6.7 nurses per 1,000 inhabitants. Furthermore, we have also one doctor and one nurse, instead of one doctor every 3 nurses. Moreover, just a few nurses are in leading positions, and if you find some nurses working as general director of some health trust, or more often, president of a provincial nurses order, they are male nurses. Next, please. We see from data that nurses are insufficient to guarantee adequate nursing care in any context of care, not just in hospitals. Nurse shortage has been an issue since I started to work after my diploma in 1981. Next. A lack of vision and of planning along with other complex factors have always compressed nursing profession from above. To this problem has always been regularly added an even greater erosion from below. Data from a survey conducted in 2015 show this data. Most nurses in Italy work as public employees, and 78% nurses are working in hospitals. In nursing, precarious work prevails for female nurses. And you can see the differences also in gender and age groups. Among nurses, there is a clear difference. Among men, the younger classes wait less. And now the second point. Next, please. You can guess what these numbers, we really worked miracles. We did more than our best in the front line, and we are still doing miracles with these numbers. This is the ratio. In this slide, you can see the ratio. I mean, the number of patients each nurse has to care in Italian hospitals and in each region too. These, on the other hand, are recent data on COVID-19. The next 2-3 slides quite quickly, just to show you the impact. These data are of last 30 days and from February. I have to show you some other very sad data. Next, please. This just to give you you know, in Italy we use these colors, red, orange, to see them, to show the number of infected people. And I have to say that nurses are also suffering for violence in the workplace. Next slide, please. Just to show you this number. I don't comment this data. Especially in the last 20 years, the trend has been to reduce hospitals' number and to cut hospital beds. However, no resources were used to plan well-developed primary healthcare services for the community, nor emphasis was put in health promotion and disease prevention. In Italy, what we call primary care has been led by medical doctors with a two-week link with general practitioners. In the next slide, and the following three, you see how we coped with COVID-19 pandemic. With just a few nurses in powerful positions, we made the difference, taking the lead from the practical point of view, in an informal way. These data show you how many beds we implemented in intensive care. We doubled the number of beds. And we transferred nurses from a hospital to another. We increased number of beds with the same staff. We trained nurses working in general units or operating theater to be able to work in intensive care unit because we needed them. We did our best to keep our COVID patient relatives informed and connect about the health status of their dear ones. Next, please. Unfortunately, we had to give with doctors many bad news to people. Next, please. I listened to a lot of colleagues and former students just saying too many deaths. We saw too many people to die. Next. Another issue for nurses has been to experience the death of patients, next please, in solitude with problems in ensuring the spiritual care they required. Especially in northern Italy, COVID-19 pandemic has also caused the death of many hospital chaplains. And frontline health staff had to provide spiritual comfort to dying patients. Everybody did his best to prevent patients from dying in total solitude and isolation. This problem is still present in hospitals, but not just in hospitals, in nursing homes. So we have the problem of abandonment of elderly. Now, the second point, the challenge we faced. On the main ethical challenge was the fear to have to choose also among patients. As I said before, we had a shortage of nurses in hospitals. In 2 months, we had more than 10,000 nurses and a total of about 20,000 healthcare personnel hired with a temporary contract. And that is an important message. Nurses shortage, we had to work 12-hour shifts and there were unemployed nurses. Why? It's a very important message. Now, go on, next please. The third point, the reality now is that while we are struggling to vaccinate as many people as possible, we lack healthcare personnel, we lack nurses. It's not surprising. Next, please. It's not surprising. I quote the word of the medical doctor, a director of Bologna district. He said, this wave is worse than the first one because we have all the services open and work is underway to carry out a mass vaccination with a pandemic in progress. There is no similar experience in human history. Next, please. And in the meantime, we are not, health managers are cutting resources to nursing education. And this is my personal experience in this period. Now I'm moving to another issue, the change in our visibility. Yes, this sad data I already quoted. The next slide show you some news from newspaper. But my comment very quick is, was COVID needed in Italy to make people understand who nurses are? And in spite of this positive feedback, I believe most of our work has been, and still is invisible. Rarely, nurses took any merit for what they have done. Rarely they have been represented in media in a realistic way. explaining their role and their work. The picture of an Italian nurse went around the world. However, we have just a few nurses at regional health service level, none at the ministerial level, and just a few nurses sit in the decision-making tables. We need to rebalance health promotion, next please, next promotion, disease prevention, diagnostic therapeutic processes, and some key, I showed you just some key words in this slide: integration, hospital and community-based services, and continuous care. And we need to change, to be more visible, to give voice to what we think. And this rebalancing means also change and go from resilience to flexibility as the proactive aspect of resilience. Flexibility means one can move resources according to the sudden needs generated by a pandemic, for example. And some residual rigidity, sometimes corporative, certainly does not help us, not help when the country needs solidarity and collaboration. The last word is redundancy. We learned that we need to have a reserve of resources at our disposal to cope with emergencies. Otherwise, when we need them, we haven't. And I go to the conclusion. I believe nurses, and especially women, can make a difference. Next, please. As we have a special perspective of problems, attention to the good of others. In this historical period of our life, all healthcare professionals need to work together, and we need to look at common goals, the health of our citizens. And if we forget the fact that we work for the good health of everyone, we will miss this opportunity. No more barriers among different professions, more fairness and decent pay for everybody. We cannot cure infection only with doctors, nurses, and vaccines. We have to work on personal behavior and care in social relations. Awareness and responsibility are two of the key words of this age. And I end with these 5 points. If I have 1 minute more, I don't know.
Go
These
ahead.
are the things that worry me at the moment. Low birth rate is really working in Italy, and the lack of career ladder for nurses. How can we attract young people if we have no career, not yet career? And there is a huge disinvestment in nursing education. So it's a very short-sighted, I say, and we desperately need advanced nursing practice development. We are not working at the full potential of our role. And then stop violence against women. We have a huge problem in Italy. And I think that as nurses, we can do a lot about this, also in this. And I thank you very much for this opportunity. Last, with my greetings, and thank you very much again.
Thank you so much, Cecilia, and thank you for sharing the situation in Italy. It is completely unacceptable that more than 50,000 nurses who are women contracted COVID-19. And my heart goes out to all of the nurses who are still there now battling the second or the third wave that we've heard about recently. So this brings me to ask, why are issues like nurse safety and fair pay and protection a gender issue? Our next speaker will dive deeper into these issues and look at what is needed to keep nurses safe. Hoishan Fokalade is a registered nurse and holds a Master's of Science in Global Health. Hoishan is a policy advisor at the International Council of Nurses and has been leading the monitoring and analysis of COVID-19 related infections and deaths in nurses and developing ICANN policy on a wide range of issues, such as protection and well-being of nurses during COVID-19, primary healthcare, and patient safety. In her past work, she has worked on emergency operations at the international level and has field experience working with refugee populations in the humanitarian sector. So I will now invite Hoishan to the floor.
Thank you, Erica. Good morning and good afternoon, everyone. Thank you for having me to be part of the panel. It is wonderful to join the expert in the panel to highlight this important issue in creating gender-responsive global health. Next slide, please. I'm very happy to be here speaking on behalf of International Council of Nurses. As Erica mentioned, we are an organization with over 27 million of nurses worldwide. And you can see on the map that the country which have National Nurses Association that we work with across the 6 regions. And ICN was founded in 1899. We're the first NGO recognized by WHO. We're also the first and widest reaching international organization for health professionals. The goal of ICN's work is to enhance the health of individuals, populations, and societies. Next slide, please. As some of you might know, 2020 was the year of the nurse and midwives and was supposed to be the year for us to celebrate the contribution that nurses and midwives make to the world. It turned out COVID-19 has had a significant impact on the health and social structure of the world. As of yesterday, over 2.6 million lives has been lost and over 120 million people have been infected with the virus globally. Many nurses in the course of their professional duty have contracted the disease. ICN has been tracking and monitoring COVID-19 related infection and death among nurses in the pandemic. And as the end of January 2021, nearly 3,000 nurses have died because they were doing their professional duty and did not always have the protective equipment they needed. I would like to take the opportunity to pay tribute to all nurses and other health workers for their incredible response they have made. You can see on the slide, it shows pictures of nurses working in different countries, in Iran, in Italy, in South Korea, in Taiwan during this pandemic. Nursing is the largest occupational group in the health sector, accounting for 60% of the health professions. Nurses, who made up the majority of the healthcare workforce, are at the center of making the healthcare sustainable in the pandemic. Nurses are also there every step of the way, from testing to diagnosis, to treatment, to palliative care, end-of-life care, and disease prevention. And as this pandemic worsened, nurses work tirelessly to provide care for patients, and they are dealing not only the virus, but like Cecilia mentioned, they also take care of the psychological impact that it has on patients as they are totally isolated from their family. Next slide, please. ICN has been working very closely with our National Nurses Association since the beginning of the outbreak in China. ICN hosts regular webinars and talks to share useful information and learnings. And in August 2020, ICN undertook an online survey of 52 associations. The survey covers different issues related to nurses and other healthcare workers during the pandemic, including personal protective equipment supply, infection prevention and control training, violence against health workforce, and the psychological support provided to nurses. The survey results provided a snapshot of the challenges nurses face at that time, and in some countries, the challenges still remain. Looking at the healthcare sector alone, women were affected tremendously. The global nursing workforce is estimated at 28 million nurses, and 9 out of every 10 nurses worldwide is female. ICN survey results found that the pandemic has taken a heavy toll on the physical and mental well-being of nurses. And here are the key findings. On the economics and well-being aspect, less than half of the NNAs report that COVID-19 is recognized as an occupational disease for healthcare workers. In most cases, the access of healthcare workers to entitlements and compensation due to the COVID-19 is highly linked to whether the virus is classified as an occupational disease. And less than half of the NNA report the compensation is available from the government for healthcare workers infected with COVID-19 following exposure in the workplace. Among those countries providing the right to compensation, the eligibility of claiming the compensation highly varies across countries. The additional occupational risk and the mounting demands and pressure in work have led to a wide debate of wage levels and remuneration in some countries. Also, 60% of the NNA have sometimes or regularly received reports of mental health distress from nurses in COVID-19 response. Burnout, anxiety, depressions, fear of stigma, and discrimination are the common mental health issues reported to our NNA from frontline nurses. The results also revealed a lack of protection of nurses in many countries. NNAs have expressed the shortages of PPE in different healthcare settings, particularly in long-term care facilities. Lastly, more than 70% of NNA have received reports of incidents of violence or discrimination against frontline healthcare workers. Like our president have mentioned, some NNA reported nurses have been refused housing rentals or have been turned out on the street. And some nurses have encountered problems getting childcare due to their work as a nurse or midwife. So we can see that nurses are facing many challenges in the pandemic, and they are also subject to specific aspects that put them in a more vulnerable position. The global nurse shortages, lack of protection and psychosocial support, increased occupational risk are the additional problems to the challenges that are common to all female health workers. Next slide, please. So we need tangible action now to achieve gender equality. In 2020, the State of the World Nursing Report, one of the key actions identified is that countries should plan for gender-sensitive nursing workforce policy. That would be an important step to achieve SDG 5 in gender equality. ICN and WHO calls on government to maximize support for nurses in the front line against COVID-19. Investing in decent working conditions is urgent, and it requires adopting a gender lens. Countries need to ensure gender equality is at the heart of their COVID-19 response and recovery plan. And we need to acknowledge the values of nurses. They are not caregivers, but also professionals, and take into account their needs and interests, building their resilience, and making sure their voices and experiences shape decisions. Next slide, please. So that's all for my presentation. I look forward to the Q&A section. Thank you.
Thank you so much, Hui Shen. I think you clearly showed that women as nurses have been disproportionately affected by this pandemic through things like violence, abuse, psychological trauma, and discrimination. Our first two speakers, both Hui Shen and Cecilia, have very clearly shown the need for gender responsive global health and health systems and how nurses are at the center of this. So this is a perfect segue for me to introduce to you our next speaker, who will look at the importance of nurse leadership and full and effective participation in global health decision-making, and how this can address some of these issues that we've encountered and prevent them in future crises. Bongi is a bedside to boardroom advanced nurse practitioner. She is an exceptionally gifted, innovative, practice-focused scholar recognized internationally for her work in advanced practice leadership, emergency and primary care, and interprofessional education and collaborative practice. Bongi led the Anglophone Africa APN Coalition Project and is the founder of APN Africa, a social enterprise supporting the development of advanced practice roles in low and middle income countries. Bongi, a very warm welcome to you, and the floor is yours.
Thank you, Erica. Welcome and thank you to our participants as well who joined us today. It is my absolutely honor to be part of this panel to look at nursing leadership and high-level decision-making. And today I thought I'll give it from a perspective of advanced practice, highlighting the work we did in Africa to lead nursing and to lead advanced practice progress. So FNP is the family nurse practitioner, and in other countries, it was referred to as a primary care nurse practitioner. It's just the same thing, different terminology. And I'll look at this from the focus of the Africa Forum for Primary Healthcare, Afro-PSC, where I'm a core team member responsible for setting up the agenda on PSC workforce in Africa. Next slide, please. So with the policy, really, as we all know, there is the importance of using evidence-based approaches, as well as ensuring that we set the right agenda and our policies are addressing the problems that are occurring and that we want those policies to achieve. So from an Anglophone APN coalition, there were really a number of drivers around this, and those drivers came from the context of each country. So they ranged from availability of clinical faculty to deliver the education, to accessibility of primary healthcare services to community, to complications in making referrals. In Africa, almost 90% of primary healthcare is provided by nurses. So something that both Cecilia was also highlighting, and as well as our President Annette on this. So this meant that we needed to focus more on how family nurse practitioners were mushrooming. They were mushrooming, unfortunately, from a very different perspective, money funded by donors, and also there was a Western, a Western, I would say, a Western lead on it rather than it being led by the African leaders, which made it very difficult for communities to accept this progress in nursing. So therefore, we collaborated across the countries that were developing advanced practice to see what these problems were, to really identify them using a conceptual framework for advanced practice by Chopra et al. And we really started from there. We had high-level collaborators, and those included the ICN APN network, where I was a member of the co-steering group. They included JPIGO, an affiliate of Johns Hopkins, who have a really strategic level input at government level across Africa, and as well as the Africa Federation for Interprofessional Education, which focuses on interprofessional education. And from my policy perspective, I approached WHO Afro Director Moeti at the time, just because we do not have a chief nurse, just like any other region in Africa, there is no regional chief nurse. So I had to sort of self-appoint, if you want, to put it that way. I sort of had to self-appoint to take responsibility of this work, because there was no one else to do it. And she then suggested that this developing advanced practice looked like an absolutely great concept to address UHC and SDGs, and suggested that we approach the health systems department, which we did. And the health systems wanted evidence. Why were these roles necessary in Africa? What was going on in terms of other countries in advanced practice? And as you can imagine, with so many nurses not being in leadership and having to discuss those issues with the WHO Afro systems, who were neither nurses nor midwives, was quite a challenge. But we managed to get there. We reached a stage where they wanted us to bring up case studies, and we combined those and collaborated and submitted our proposal for advanced practice nursing to be made a policy priority within the region in October 2018. And this was a real challenge, not only because I'm a woman who was leading this work, but also because of the cultural and religious issues really that are within the context, especially in most Africans. So there was really questions about who is this young woman who is driving up this initiative. I was, however, very fortunate to have male allies that Liz was talking about. So I had male allies, Wonka president, Prof. Shabir Musa, who supported me. And I also had Dr. Stephanus, who was the lead for the AfriPen, the chair from South Africa. They were both very supportive, connecting me to the right people, and co-leading some of the sessions I was having to deliver. So in terms of really the gender responsive global health, I wanted deal much on that because we have a really great document delivered by Women Led by Men, a gender and equity analysis of the global health and social workforce, WHO 2019 document, which clearly delineates the gender dynamics that we have and why that is inhibiting the progress in nursing leadership. Provides recommendations as well that Erica has already touched on how we can really solve these situations, especially around addressing the gaps and the literature on generating the literature from research to reach equality. Next slide, please. So we did our work really in stages. Our agenda setting was in Rotterdam. We did that as we took advantage of the ICN APN conference that was there and planned in advance. At this meeting, we agreed to set the coalition, which included all the organizations that are listed there. There were representatives, this was an African-led. We wanted an African-led policy driven by African leaders. Because in the past, we have had policies that have been, not deliberately, they have been developed, but they have had so much Western influence such that they didn't speak to the African people. We started those conversations, and in 2018, as I said, submitted the APN proposal. After submitting the APN proposal, there were questions about what happens then while we wait for WHO to act on our proposal. So we set up some workshops to really look at the regulation, accreditation, and credentialing and education of advanced practice from a global perspective, giving African leaders, academics, regulators, and government chief nurses who were present or represented the global perspectives of the standards. We then did a step further on that, following some of the issues that were identified around the availability of clinical faculty. So based on the fact that most of our clinical faculty for advanced practice program come from the US, I took that opportunity to move to Boston, Massachusetts, where most of my colleagues are based, and interacted with the global sectors, interacted with academics who are involved in these projects across Africa, and mainly it was really the Kingdom of Eswatini and Malawi, where we have advanced practice midwifery and family nurse practitioners, respectively, as part of that planning. We then went back in 2019, now focusing on the African and Afrocentric really perspective of the REST model. So how do we do this regulation, accreditation, and credentialing and education that we have standards, international standards on? How do we really do it in an African perspective that is meaningful to the context where we are? And to do that, we looked at the family nurse practitioner, because that was a universal role in terms of advanced practice. So every country will need an FNP to achieve the UHC. And as Celia was saying as well, that in Italy, PHC is driven by family doctors. It's almost the same in many African countries. So it's driven by doctors, but they are not available. So the nurse makes decisions, and after a week, a doctor comes in, either agrees with the plan that was there or changes it. So why don't we just train this primary healthcare professional to provide the holistic approach? So we had these workshops, and we had an agreement that it was not a complete consensus, because as you can imagine, Africa has 54 countries, more than 20 of those are Anglophone, which were countries that we're working on. And then you've got more than 20 countries which are Francophone, who were not involved in this as well. So we had an overall agreement that we needed 2 entries, master's level and BSc level, which is where we are as a continent. Next slide, please. I would not deal much with the State of the World Nursing Report because Erica has already covered that. But really, in terms of primary healthcare, it gives us an evidence-based tool that we can all use in different countries to highlight and to advance the advocacy and policy to increase advanced practice. It also gives us a standing point of portraying the nursing as a STEM, really as a science and technology, because that's what advanced practice mainly deals with in terms of clinical practice. However, as we know that the WHO Global Strategic Directions for Nursing and Midwifery have been drafted and are awaiting the WHO to be adopted, it will also be important for us as a region to be thinking about what specific issues are there in those global strategic directions that we really want to take and make them focused on our region at every regional level. Next slide, please. So yes, so from starting this work in 2018, submitting our proposal to the WHO in Afro, in 2020, we had our guidelines on the Anglophone Africa APN Coalition as part of the international guidelines for International Council of Nurses in Advanced Practice, which is a really extraordinary achievement, thinking that this is work that began in the rural areas of Zimbabwe where I was volunteering, and that decision coming up and us getting into international policy within 3 years. And this really has made leaders even in Africa realize and appreciate the work that ICN has been doing, particularly in the last 5 years. We have seen a move from where we have had policies that were international, but actually didn't speak to the African community. And for a change, we now have that, which is really progress. Next slide, please. And then obviously we have the IND 2020, which I was privileged to be part of the committee Nursing the World to Health. And that we cannot overstate the fact that we have seen nurses across the world doing that, just nursing the world to health as we fought the COVID-19, and we know that's gonna go beyond. But more important, it is also the opportunity that the IND 2020 gives us on the recommendations on a APN policy dialogue on entrepreneurship and innovation, and as well as thinking about advanced practice program as part of our workforce modeling as we plan our workforce, and as well as looking into evidence underpinning labor markets. Next slide, please. Next slide, please. So we continue our work focus really on primary health care and ensuring that we are there in the decision-making tables at Afro-PSC. So Afro-PSC has 3 key nursing members in there, with Tembega Kwakwa, who is the second vice president of the ICN, myself, and Nursing Now Africa representative Judy Kanyola. And in terms of allyship, I think Afro-PSC really takes that leadership. Prof. Shabia Musa, who is the Wonga president, has played a key role to ensure that nursing is represented in ensuring the PSC workforce planning at regional level is maintained, and nurses are valued as well. So, but this cannot only be done by one profession. So it's important that when we do these high-level decision makings, we are working in partnership and collaboration with others within the healthcare and beyond. And so working with other industries. In my work with the Anglophone, I have worked with lawyers, with senators, with members of parliament to really understand patients and communities' needs. And that's critical in terms of policy. So really to round it off, I'll say using evidence and research evidence-based practice in policy, advocacy, development and implementation is key if we are going to engage, especially high-level decision makers, and to get them to accept our advocacy needs, and the advocacy, of course, needs for the communities that we always stand for. Thank you, and happy St. Patrick's Day.
Thank you, Bongi, very much. Thank you for highlighting the importance of strengthening and promoting the advanced practice nurse role, which I think establishing nurse leadership in healthcare teams and across health systems through this APN role is absolutely critical. I also like that you mentioned the cultural and religious challenges that women often face in leadership positions or getting to leadership positions. And this is a really good example of how gender bias is deeply structurally rooted, and that it is absolutely critical that the work that we do towards gender equality works at this level of these challenges. Otherwise, we're really just working on the surface. So the critical need for nursing leadership is likely obvious to many of us, but how do we get there? And so our final speaker will share effective nurse-led advocacy initiatives that will help us achieve gender-responsive health systems. I'd like to introduce Dr. Wanda Montalvo, who is an innovative leader, an ally, advocate, and convener of diverse stakeholders. She's committed to addressing pressing health issues informed by applied science and program design. Dr. Montalvo has over 20 years of experience working with and in foundations, professional trade associations, federal government, and academia. But her favorite collaborators are people with lived experiences and emerging leaders who are Black, Indigenous, and people of color. She has a PhD from Columbia University and is a fellow of the American Academy of Nursing. She also serves on several nonprofit boards. Wanda, the floor is yours.
Oh, thank you. I want to thank ICN and Sigma for inviting me today. And I think my role here is to kind of take all the concepts that we've heard up to now and position it as, if you're a new nurse trying to figure out, where do I dive into this pool? You know, how do I move forward, and to guide our opportunities to make impact and to really be engaged. Next slide. So if you ever think, why me? I can't do anything. You know, I'm just a nurse. Never use that concept. Never refer to yourself that way. Because I love this. I have this all the time and I refer to it all the time. If you think you are too small to make a difference, try sleeping in a closed room with a mosquito. And we all can make an impact. It doesn't matter where you are, you know, what part of the world we're in. We are connected. And you do make a difference, and your voice counts. Next slide. So when we think of all the work that our previous panelists have spoken about, you may wonder, like, you know, what are the risks? What can I do? And in many times, I want you to think about a turtle. A turtle only moves forward if it sticks its neck out. And I think with all the various areas and where we're working and this global pandemic, our opportunity to impact life across the spectrum, nurses and women especially, are critical to this effort, but we have to be willing to take a risk. And that is part of what it is required when you want to engage in policy advocacy work, and taking these risks are the only way we are able to move some of our agendas forward. And you have to think about, you know, how do I move beyond my own kind of insular world and self-interest, and think about, how can I take the talent, the critical thinking skills, all my preparation, and move that forward to be part of the solution, to be part of the problem solving, to get at the decision-making table and influence people that are at that table, and to work with allies. Next slide. So I thought it might be helpful for us to kind of reflect back as to where we might feel we are at. If you're thinking that, you know, I don't know if I buy into all this, you know, policy advocacy stuff. Some people just tune it off when you even use that word policy. But I want you to know that we kind of make policy all the time, especially if you're a woman and mom or whatever. You know, if we say bedtime is at 9 o'clock, that's already a policy in our home. If we think about what are the policies in our workforce that impact us, the lack of, you know, PPE and everything else that has occurred, our income, that those are all, other components of the policies that are around us that impact us day to day. So it's important for us to kind of think about this and wonder, where can I start being part of the solution and problem solving? So I thought this, scale might be helpful for people to kind of see where they might be. Very simple components in stage one is just kind of a buy-in and an awakening, kind of reacting to what are some of the issues impacting us as nurses and as women, and starting to kind of figure out how can we start developing some of that simple political language and understanding, what are the components of coalition work that's happening around us. And I think working with ICN and Sigma and WHO are components of that. And a very simple, small step is just reading some of the content that's already available to us, being able to become familiar with what are the terms, and being able to use social media and other ways to amplify, at a minimum, the message that they're trying to get out, and support some of those campaign messages that they're trying to get out. Those are very simple kind of stage one components. As you kind of move a little bit into stage two, where you're kind of a little bit more reactive and engaging, it's becoming a little bit more familiar with, what are the jargons that we may use in nursing that other policymakers and decision makers may not understand, and helping to kind of bridge that language and to form relationships and starting to build and move forward with some of the momentum that might already be occurring on the ground with our professional nursing organizations, and being a little bit more reactive to what's going on. So right now, if you think about what's going on with COVID, vaccinations are rolling out. But the other challenges that we're seeing is the amount of potential misinformation or disinformation around that. What is the opportunity right now? So low-hanging fruit. Nursing is the most trusted profession. What is the opportunity for us to, be messengers in this and work with organizations, again, to kind of move the needle on that? Later on, as you become to stage three, you might be a little bit more politically sophisticated, more engaged, maybe working on committees, being able to inform policy. Some of that comes from your lived experience. Some of that comes from research. Some of that work, is working with our allies and accomplices. And later on in stage four is kind of really leading the way. And I think in some ways, when I think of this, I think of more formal organization work and coalition work, to be able to introduce concrete policies. Our previous speaker, Bonnie, did a really good job of that, showing how they kind of informed some of the strategies in order to move advanced practice forward in Africa, and how can we then take that language and build upon what is happening globally, what's happening in our own backyard. But I just want you to kind of see through the stages of how we could potentially move, but always know that there is a place for you at the policy advocacy table. And it's really critical that we support our nursing organizations that are trying to influence and lead the way in these areas. Next slide, please. So the way we kind of move through advocacy and strategically trying to influence is to kind of understand that environment, being able to see that, where can we as nurses understand the opportunities to raise awareness and create allies in the public sector. So the way I think about this is, if we're playing, a football game, and oftentimes nurses focus on the players on the field and with each other in our own organizations, when really we need to be starting to look at who is sitting in that audience, in that arena. That public plays a really important role in helping to also forward our message and to advance that. What we're trying to say is that where nurses need to be at the decision-making table, need to be part of the solutions, and need to be part of the design. And so as we kind of move across from the public to identifying key influencers that can help, again, forward that message for us, sometimes they're gatekeepers, all part of the strategy to get to those decision makers. And you may start with awareness, which is on the y-axis of this kind of visual that I've provided here, and moving into action. How do we develop the will with public messaging and campaigns? Our speaker who highlighted in Italy how they were promoting, and giving nurses a lot of good press in the media. How do we turn that around so that the media is advocating for our key message, right? We have built a lot of goodwill. So how do we leverage that and develop champions and coalitions to help us really influence legislation, how we vote for people, how do we inform regulatory strategies and provide feedback, and kind of moving that along. And oftentimes we're not just in one sector at one point. Sometimes it can be, in various sections of this. But what I want you to see is that, you can move across and up. But at the end of the day, what we want is to be, really either the policymaker ourselves, or making sure that the policymakers are really supporting our key messages and moving that work forward. Next slide, please. And one of the things that I think is really critical for us to think about is, this power building coalition component. We need to make sure that we, as women and nurses, gain power in order to really influence the way that we want to be given gender inclusion and equity and fairness and across the spectrum. We, previously one of the speakers says, if 9 out of 10 nurses globally are women, that is a powerhouse component. And as the people that might be marginalized and not at the table, it is this grassroots component that actually helps us to start building capacity and power. And so being able to exercise that power strategically is a real and critical component of moving the work forward. I think one of the other powerful things about nurses and working across the spectrum and building on each other's talent is that we're so highly prepared and so highly educated. And most of the time, the public is not aware of our preparation and how we are very innovative and able to do a lot of problem solving components. I mean, when you think about how nurses globally have responded to this pandemic, and I keep thinking that, there's still residual and a lot of other things across the spectrum of our healthcare system, that it's essential that we are given that voice and that inclusion, or we're not going to get past it. It's like working with half the brain. You cannot exclude us because we have some of the most frontline experience and oftentimes have the pulse of what's going on before anybody else. So it's really important to kind of build that ongoing capacity. And sometimes we start with our own internal organization, being able to influence policy there, making sure, I'll go back to some of, Bongi kind of took a leap and started, using your network, leveraging that network to be able to move those messages forward. Who are the allies? How do we assess that? Who are the coalitions that have the right capacities in place? And where is it that we have agreement so that we're crossing the aisle and working with others that can help forward that message together? But the real kind of component is that we need to be comfortable with pursuing and engaging and bringing some of that power to our work as nurses and as women. Next slide. One of the things I thought was really important to kind of just bring to your attention, and this is just a snapshot of a more comprehensive assessment. But I think when I think about, coalition work, or when I think about, where do I want to spend my time, my talent, and my treasure, I look at the functions of an organization and coalition work and grassroots effort. And I think through, what is their strategy and their plan? Are they in a good place where they're building and using evidence? What are their goals? Are they in alignment with what is achievable? Where are small wins? And so being able to think through and do a real assessment of the organization or advocacy group, I think is really important, because it's an objective way to see where are your strengths, where are the weaknesses, and what are our strategies for moving that forward. Or else you may be going around in circle and really not be clear in what your agenda is. Agenda setting, making sure our message is clear, that our constituents understand that the public understands that. Because if that decision maker or legislator, whoever it is not listening to us, we need to think about how do we engage the public to help forward that message in a strategic way. But in order to do that, we need to kind of compile our evidence, be very clear, remain evidence-based, use data, and to be kind of objective, but also remember to bring that kind of personal story to move, again, our core messages. I will say this, because I think it's really important. Nurses need to get on social media. It's a even playing field, and being able to use these various platforms, again, to get our core message out. Next slide. So at the end, what I wanted to just kind of show is this table of how we would move across and up. And at the end of the day, that if we're using all these kind of building blocks of strategy, we're able to really not only increase knowledge and awareness of the issue, but really to either develop new policies or inform policies as they're being developed, build on our collaboration to move to action and real decision-making, that we can monitor outcomes and change policies that in many ways is not to be self-serving, but we know that as nurses and as women, that when you advance us, you advance everyone, because we are a cornerstone of the economy, our healthcare system, education system, public health, and we care for people from birth to death. And thank you for your time.
Thank you so much, Wanda, for such a very clear and very compelling presentation on the importance of nurses amplifying their voice, their expertise, and engaging in policy advocacy. Because of deep gender inequalities in societies, some of these skills that you mentioned are really not taught to us as women. And to gain power and to be leaders, I think you're right. We absolutely need these skills, and we need to feel comfortable using these skills. And that is work that needs to be done. Hearing all of the speakers today has made it even more clear that one of the keys to building back better is through the full and effective participation of nurses in health systems and global health decision-making. And we've seen some excellent examples of that in the last hour. I would now like to open the floor for questions, and giving participants time to put their questions in the chat box. I do have a question that I will pose to each of the speakers. It's a very simple question, but quite powerful. So my question to you all, if you'd like to all turn on your cameras, that would be great. My question to all speakers, and I'll go around in the same order as which we started, is what is, if you had one top priority action, and I know there are many, but one top priority action for making health systems and global health gender responsive, what would that be? And so I'll start with you, Cecilia.
Okay. In one word, I think unity. Join effort, energies as women, learn to work together.
Thank you. And I think during this pandemic, we have absolutely seen that unity across systems, between people, between countries is absolutely essential. So thank you for that. And Hoishan, what would your one action for making health systems and global health gender responsive be?
Thank you for the question. I think it's really important that we have investment in nursing, this profession, and nurses should be well supported. I mean, we all know that nurses are important, not because of the numbers, because we are large numbers of profession, but also we provide a wide range of health service. We deliver safe care, effective, respectful, quality care, and we need investment in this profession to do so. And nursing now, they're undergoing so much pressure because of the lack of protection, because of the lack of investment, and we need to boost up the investment in countries to let people know about our professions and to develop. And it's a win-win situation, because when we invest money in the nursing profession, we advance the gender equality agenda. At the same time, it's the global health agenda. So it's a win-win situation.
You're absolutely right. And I think money talks, but it doesn't talk for money's sake. It allows us to be able to be there, to have manageable workloads, to be prepared with the right skills and knowledge. And so really investment in nursing, I agree with you, is essential to continue our work. And now I will ask the same question to Bongi. Bongi, what is your one action to make global health systems gender responsive?
Well, like political astuteness is not an option anymore in nursing. So from an academic angle, I would like to see policy and politics in nursing, right in curricula, every nursing curriculum, even at undergrad level, because we need to be preparing future leaders to be politically astute.
Absolutely. And I think that speaks to as well what Wanda was saying about really preparing us to do the job that we now know we're required and essential to do, and changing the curriculum to reflect that, rather than trying to catch up once we're graduated and in the workforce, and trying to gain these skills on top of everything else that nurses have to do. So thank you for that. And Wanda, what is your one action to make global health and health systems gender responsive?
Embracing lifelong learning that I learn from looking at other sectors to inform our strategy. And I agree with Bongi that the earlier on that we can introduce the discussion of policy and our role in policy, the better. I think people get scared, but we have to be tenacious because it's required that without us, you cannot gain the best solutions.
Thank you. Yes, tenacity is something that nurses, I know, possess very deep inside them. Some of us are better equipped to bring that out. I love how Bongi said that she stood up and took the role of leader just because there was no one else to do that, and she had to sort of self-appoint herself. So I think that's a really good example of leadership and of being tenacious and putting your turtle head out before your shell. So thank you for that. So we did receive some questions prior to this session from some of our students, actually, in the nursing student group. And so I do have a question from one of the students. And this question is as follows. We have education. We know that education is the passport to the future. And today's nursing students are receiving their nursing education in unprecedented times due to the COVID-19 pandemic. How are nursing education programs in your regions preparing your students who are nurses of tomorrow for future public health crises? So I open the floor to anybody, any of our speakers, or Annette or Liz who would like to answer this question. Cecilia, yeah, you just have to unmute yourself.
Well, I'm working nursing education, and I think the main issue now is to help nurses and nurse educators to work with enough resources, and also avoid that bureaucracy and administrative problems issues stop clinical practice. Because I mean, our students are forced to stay calm, to stay at home, instead of going and helping in hospital. We have all them vaccinated. They can do a lot of work. Also because as soon as they get their degree, the day after, they work in COVID wards. But if you prevent them from this experience, so I think to all the students, go on work and ask to work. I mean, force, bureaucracy and policy issues, local problems, and go and do your practice, because you need it. Otherwise, you can't learn. It's not just theory. You need practice.
Absolutely right. Does anybody else want to give their thoughts around this question? How we're preparing nurses of tomorrow for future public health crises. And of course, I think that this is a work for the future and something that we're currently working on, but your thoughts are welcome. Liz, yes, please go ahead.
So, because we have chapters in more than 800 schools of nursing around the world, we've heard firsthand about how challenging it is, whether the students, like Cecilia said, cannot get into the clinical setting, or if they're being, in some countries, they were released early into clinical practice. I think anytime, there's always a transition, we know that, but especially a transition during a pandemic is particularly challenging because the usual resources that new nurses have may not be in place, right? So the additional supports, they sort of get really sort of thrown into it in some ways. So, we know there have been students who have been very challenged as new graduates, right, going into the role. It's been a challenge for the faculty too. I mean, I think there's, we know that nurses who are in clinical practice have been emotionally and physically and mentally impacted. I would also argue faculty and students have too, because of all the changes, right? And so the faculty feel like they're not sure they're always able to give the students everything the students need because of the realities of the situation. It's not that they're not trying, but that there's so many limitations. So I think this is again where, although we have promising information about prospective people coming into nursing, we do know that the pipeline issues, right? We know there've been pipeline issues. And so even though there have been increases in applications in many countries, because of the amount of time it takes to educate someone to be a nurse and to assume competent clinical practice, we know that we're going to have a gap. As Annette I addressed early on, we already had a shortage. The shortage is getting worse based on what we're hearing from the National Nursing Associations and other groups. And we're not going to have enough nurses fast enough to meet that gap.
Thank you, Liz. Annette.
Yeah, I think the first thing I think we have to do is to realize that nurses have been brought into the pandemic very early without any great support or education. And I think we have to listen to them. We have to allow them time to think about what they have seen. A lot of them have been left to look after patients who are dying without any previous experience, perhaps. And I think that's going to have a stressful effect on them. I think that we underestimate what we can learn from students. I think they have great ideas and great initiatives, and we should learn. They are young, they're used to social media, they're used to artificial intelligence, they're used to all of this, and they should be brought into the whole world of technology. On the other hand, I think that nurses should take the lead in looking at different models of care. I think we have for so long had the wrong models of care. We've seen that very clearly in COVID-19. We should have invested in public health. We should have invested in primary care. We should have invested in health promotion, disease prevention, early intervention, screening, all of that, bringing the healthcare to the patient as opposed to bringing the patient to healthcare. We have invested very heavily in hospital care and specialization in the last 10 years of people's lives. And we have left total inequity, not just across countries, but in countries. And I think nurses are in the best position to direct a different model of care. And I would suggest that, educators, curriculum, people in clinical practice should all be involved in making their voice heard into the way that we can best develop a different model of care. And we have to do it now.
Mm-hmm.
Thank you. And I saw everyone on the screen shaking their heads to every point you made. It's absolutely correct. And sort of what a big challenge new nurses have and current nurses coming into a health system at this time. I think they are so well positioned to come in with these brand new eyes, as you've said, and take a look at some of these gaps that have long existed that perhaps some of us are sort of used to seeing, having worked in these systems for a while. So it's that fresh new perspective with now a completely different twist from the challenges of the pandemic. Thank you for the answers on those questions. I do have one more question that was submitted, and it's directed at Hui Shen. And you spoke about recently collected data that ICN collected. And I'm wondering if you could tell us a little bit about the impact of COVID-19 on nurses, in particular on their mental health. Because I know you covered a lot of topics over a short few minutes, and mental health is a really big theme that is coming out. So if you could just quickly speak about that, that would be much appreciated, Hui Shen.
Yeah, thank you for the question. So we can see that actually in the COVID-19 pandemic, there's a huge increase in the healthcare system in the past years since the beginning of the pandemic in March. But we also see that actually country, they don't have the capacity to deal with the increased need. They are not able to meet the increasing needs with more nurses or the increase in health workforce with such a short period of time. So we actually ICN have received quite a lot of reports from our National Nurses Association that there are different strategies that used by the countries, like nurses are being redeployed into other care areas or specialty which they are not very comfortable with sometimes, or sometimes nurses, they need to work longer shifts and extra shifts and to deal with the urgent demands. So all this kind of extra workloads and demands is really add up to their mental health. And that's why ICN has been saying that we observe and we suggest there's a mass trauma of nurses have been experiencing with their mental health. And not only the reports from our National Nurses Association, but also like emerging evidence and studies across the regions around the world. So it's really a global phenomenon. So nurses, they're already stressed before the pandemic, but this pandemic has really exacerbated the mental health impact.
Thank you, Hoishan. And so I have another question that I'll open up for anyone to answer. It has been said that nurses are invisible, and we actually heard one of our speakers say that today. And so using a gender lens or looking at this through a gender lens, how do you think we make the work of nurses more visible from a gender perspective? Wanda?
I think that we should be taking advantage of the media coverage we've been getting and leveraging it. We're not doing that enough, and we have the attention of journalists. And so I do think that that's one opportunity is, how do we position ourselves to be viewed through that? What's the power we bring because of that to solutions and everything else? And I just want to tag on a little bit to what was shared a little bit ago about nurses are so savvy with technology and everything else that they will start developing some kind of support system. And they're already doing that. And it's something that we need to be mindful of because I think it's a really important component. But I do think that we need to really leverage the media attention we're getting in a different way and start, shifting it so that we're gaining more power.
Thank you. Bongi.
Yes, to add on to what Wanda just said, let's also take advantage of the work already done by Nursing Now. I know it's coming to an end officially, the campaign, but let's run with that flag and ensure that visibility that we got through Nursing Now continues. And as well as challenge decision makers. Our organization, the Society of Nurse Entrepreneurs and Leaders, we one of our goals is to challenge these conferences, the large conferences where people sit and talk about nursing workforce and healthcare, and we question those people to say, where is your nurse? Ask the chief executive, where is your nurse if you are making those decisions? So that's what I'll say. Thank you.
Thank you so much. So yeah, what I'm hearing is visibility in social media, visibility through platforms and campaigns like Nursing Now, visibility in the media, using our voices loudly and clearly. And that your hand is up. I'm not sure if that was from before or if you have anything to add.
No, I was just, yeah, I agree with what everybody has said, but I think that we also have to realize that we spend all our time speaking to ourselves. We assume that our medical colleagues and all the professionals understand what we do. I can honestly tell you, they don't know what we do. And unless we get involved with them and, get involved with their committees and get involved with everywhere. Also, we have to get involved with women's groups, with other society groups. We have to spread our, selves outwards. We are too insular from my point of view. So how do we expect society or anybody else? The only reason they recognize what we do now is that they saw people in intensive care, there was documentaries, there was all sorts of media attention to it. But before that, they did not know what we did. They did not know that we saved lives every day, that unless we were in there seeing what being there before the complications arise, being able to assess patients, that, you know, patients will die. So it's some of it is our own fault. Some of it is because we are partly, I suppose, women who are busy and everything else like that. But we do not tend to get involved in other committees and in other groups and in other community society. It doesn't matter what it is, but let's get us out there and talk to other people about what we do.
Thank you, Annette. Absolutely. And I think speaking to others outside of the nursing profession, knowing what they want to hear, what sort of language they speak in is really important, and getting those messages across in a way that is meaningful to them and accessible to them is definitely work that the nursing profession has to do. So that is all the time that we have for today. One of the participants submitted a quote of the day, and I'm not sure if it's from her or someone else, but it is, when you advance women and nurses, you advance everyone. So I will close with that. And I want to extend my sincere thanks to all who made today possible, including my very important colleagues from Sigma, Sarah Abel, who co-organized this session, and Megan Lo-Greco, who has the most important job, which is making sure that Zoom does what we want it to do. So they're in the background, and thank you so much to both of you for all of your work. A huge thanks to all of our speakers today for sharing their expertise and their insight. And we really hope that you enjoyed this parallel session. Thank you so much. Oh, and just to add, it is being recorded. And so I encourage you to share it with your networks, tweet about it, and share these important messages that we've spoken about today. Be safe and be well.
Thank you, everyone.
Thank you.
Take care.